Good afternoon, everyone. My name is Julie Parker, and we are here today outside the Executive Office Building in Rockville so that you can hear from the leaders of Montgomery County as to why the stay-at-home order will remain in effect in Montgomery County. We'll begin with County Executive Mark Elrich, and that will be followed by County Health Officer Dr. Travis Scales. Mr. Executive.
How is everybody today? And can you hear me?
We can hear you.
Everybody can hear me.
That's good.
Okay, I'll try to talk louder. I tend not to. So we want to clarify Montgomery County's position regarding the governor's announcement yesterday, and I can put it pretty simply. At this point, Montgomery County is not changing its policies, and that we'll be issuing an executive order that reinforces that effective 5 o'clock tomorrow night when the governor's order expires. So life in Montgomery County is going to continue as it was because the circumstances in Montgomery County, as well as some of the other jurisdictions around us, have not changed enough in order to make openings safe. I note that my colleague in Prince George's County, Angela Alsobrooks, just finished her press conference, and they are sticking with the current guidelines. And I know that the Northern Virginia counties asked Governor Northam to exempt them from the opening on the 15th, and he did that. He pushed it back 2 weeks. The governor in Maryland explicitly said the counties can chart their own path on this based on local health conditions. And we believe that the local health conditions don't warrant this change in policy. We do not yet have the metrics that were set out by the CDC and by the governor at the beginning of this. Those metrics have not yet been achieved, and Dr. Gales will talk more about that. Montgomery County has the second highest number of cases in the state behind Prince George's County, and these two counties have half of the cases of the state. And if you add the counties of Baltimore County, Baltimore City, Anne Arundel, Howard, Montgomery, Prince George's, and Frederick, between all of us, we have 30,000 of the 34,000 cases as of yesterday. So we have almost 90% in this corridor that comes down 95 and comes down to Montgomery County and then swinging up 270 to Frederick. So we have the heaviest caseload. That means people are still out in the community. Remember, we don't know somebody has COVID until they get sick enough to come in and get tested. And so in the time period before people get tested, they're walking around, they're asymptomatic, they're spreading the disease. The numbers of people continue to be too high out there in public who are capable of spreading the disease. Our nursing homes are taking, the brunt of the deaths. They're, I think, a little over a quarter of the total cases. But people have to remember, those cases didn't originate with the patients in the nursing homes. They were brought in by people from outside the nursing homes, people who were asymptomatic, who people didn't know were sick and came into the nursing homes and did the kind of things in a nursing home that we've been trying to stop in the general public, which is we're requiring the physical spacing, we require the masks, we require a lot of things, no assembly in groups larger than 10. We've been doing that, and we're going to keep doing that, but the nursing homes didn't do that in the beginning. And so the cases there, I think of it as a canary in the coal mine, that they are an example of what happens when you have asymptomatic people in a population and they come in contact with other people. And if you're not adequately protected, adequately distanced, if the workspaces aren't safe, people get sick. So if people are pointing to the low numbers that are occurring outside of the nursing homes, I just say to them, those low numbers are there because of what we did, what the governor did, what the counties did. We made it possible to get these numbers low. But because they're low, they're still not low enough. Because we've plateaued doesn't mean we've started on a downward curve. And so if you think about it, if our cases were going up and we implemented the steps that the governor announced when he first did his order, and then as a result, we finally reached a plateau, if we step off of our policies and allow people to do what they were doing before, we're not going to see anything but an increase in those cases. We need to be careful, and we're going to continue to be careful. We've got 400 deaths in the county, or close to it. Our hospital capacity remains high. This is one of the things that concerns us, because if there's an uptick, our hospitals can't withstand an uptick. They can't withstand another trending upward until it levels at another plateau level. So while we've got it at a plateau, we want to keep it there. Yesterday, 4 out of the 6 hospitals were at capacity for ICU beds. We're in a densely populated area. Our folks travel back and forth in a normal circumstance between all the counties in Maryland and in Virginia and in the district. And so there's a lot of fluidity, and we need to follow what everybody else is doing. I don't want to be the place that opens up and creates an attractive nuisance where everybody from the other counties that are still locked down decide they're going to come to Montgomery County for restaurants or shopping or other things. That would not be good for us, and it would not be good for the other counties. We are trying hard to work together with the other jurisdictions. I've been in daily discussions now with the county executives from the other jurisdictions. We are trying to have as similar policies as we possibly can, and we're going to stay on that track. And I want to note that we just found out that the state announced today 1,091 new cases and 1,538 new hospitalizations. That is not the kind of number that I think warrants opening up the state. So we're going to stick with the guidelines. Even the governor said he's still limiting gatherings to no more than 10 people. He's still requiring face coverings. So some of the things that were in his original order have stayed in place. I know that a lot of people think of it as a stay-at-home order, but the truth is people were able to go shopping, go to grocery stores, go to Home Depot, Best Buy, hardware stores, drug stores. So people weren't exactly forced to stay home. Other jurisdictions, other countries have done a stricter version of that than anybody in the United States has. So we're not saying that people have to stay home. We ask you to stay home, but you can go to a park and walk in the park as long as you simply walk in the park. You can't use play equipment. You can't sit at the benches and congregate. You can't open up a barbecue there and start cooking for your friends and having lunch. But if you want a simple walk in the park, take it. If you want to walk around the streets, we know people have been walking their neighborhoods. They've been walking some of the downtowns. You can do that. What you can't do is get closer than 6 feet. You can't take off your mask. You've got to do everything you can do to keep people safe. I've listened carefully to what Dr. Fauci said. I have no doubt that we are following what is the best advice from America's leading expert on this subject, and we're going to continue to do everything we can do to make Montgomery safe. And we're going to work with our partners and think of this as the same thing as why we ask you to wear a mask. That mask not only protects you somewhat, but if you're asymptomatic and you don't know it, your mask protects me. The policies we do in Montgomery County will help our residents. It'll protect other residents, and the things that Prince George's County does and D.C. does will not only protect their residents, but to help keep us safe. The sooner we knock these numbers down, the sooner we go back to normal. I want to close by saying this not being in a normal state is as hard for me as it is for anyone else, with the exception that I and many of us still have jobs. Unemployment is around 20%. Many people are still working, but it's really hard for the people who aren't working. But I would like to go to a restaurant and sit down. I would like to go to a movie. I would like to go to a concert. There are lots of things I'd like to do, but I wouldn't put what I'd like to do above the welfare of the people in this county. I'm not going to do it for me. I'm going to make sure that all of us adhere to this. I'm asking people to be patient. We will change the rules as soon as the science says that we can change the rules. When that happens, we will start down the road of reopening things, and it will be as soon as that happens, and we've got the basis to make those decisions. But our decisions are going to be based by knowing when it's safe to open up the county to a greater degree. And again, I thank you all for coming today, and I'm going to turn this over to Dr. Gales, who's done, I think, a really remarkable job so far in dealing with this, and I really appreciate all the work he's done.
Good afternoon, everyone. Thank you, County Executive Elrich. Thank you to the county leadership as well as county council as we steer through this process. This is hard. This is hard. We know it's hard. As county executive mentioned, we're all living through uncharted territory. There is no playbook in terms of how we move forward or how we navigate through this. So we appreciate your patience at home. And I hope you understand, just as we talked over 2 months ago when we had our first cases, that we are utilizing the data as best as we can to make sure that we're putting in and emphasizing policies that are keeping you safe at home, because that is our priority. Now, I'm going to list out a number of metrics that we are looking at that are consistent with what the state has looked at and what some of our other peer jurisdictions have discussed. I want to emphasize that in addition to the great collaboration that we've seen on a county level, we have had extensive collaboration with our peer jurisdictions in Northern Virginia, District of Columbia, our suburban Maryland counties, as well as the other jurisdictions throughout the state of Maryland throughout this process, but certainly over the last 2 weeks as we talk about reopening strategies and criteria. I also want to emphasize that we are, in this time, it's not the time to retreat. We actually look at it as the opportunity to be more aggressive and look at ways that we can strengthen our response to ensure that we increase the safety of our residents. So to that end, I'm going to talk about some criteria, but I also want to emphasize a couple of other steps that we're taking. For example, we are going to create an advisory panel of local experts. We do have the benefit of having lots of national agencies here to be able to provide additional insights to guide the criteria that we're going to talk about today, to ensure that we're measuring the right things, we're looking at the right things, not only in the short-term setting, but as time continues to move forward, as we move through the different phases in terms of reopening society. And so we hope to be able to make more comments on that in the near future as we identify those individuals. Now, one of the first metrics that we look at is the number of new cases. We've talked a lot about how we are working to expand testing capacity, and we know that as we test more folks, we're likely to catch more cases. The priority in this, as the county executive mentioned, is we are trying to capture as many individuals who are asymptomatic as possible, who may have been unknowingly transmitting to other folks. We are working to get a handle on what that true denominator is so that we can identify those individuals quickly, isolate them effectively, and thereby cut down on their networks of transmission. So when we're talking about new cases, we're looking at a sustained decrease of 14 days of new cases in the setting of increased testing. Now, moving forward beyond that, we know that new cases isn't the only indicator. We also want to look at a host of other factors that are related to outcomes. Again, looking at a sustained decrease in the hospitalization rate. Currently, the state hospitalization rate is approximately 19%. The hospitalization rate in Montgomery County is approximately the same. We'd also like to see a sustained decrease in the percentage of ICU beds used from a critical care perspective. We'd like to see decreases in the number of daily deaths. Unfortunately, right now, we're seeing high single digit and low teens. We'd like to see that number ultimately decrease to zero, but certainly decrease to lower digits in comparison to where we are today. We'd also like to see a decrease in the number of folks who are presenting to our emergency rooms and healthcare settings who may not require hospitalization, but are showing up with COVID-related symptoms. Now, it's important to think about those in the context, as the county executive mentioned, is those are good measures to determine what is the burden and impact on our healthcare facilities. Now, certainly if we're requiring lots of hospitalizations, that's taking up bed capacity. We'd like to see a significant decrease in that number, the percentage of acute beds, as well as intensive care beds, because in the event that we have an uptick of new cases in the future, or a surge of new cases in the future, we want to make sure that we have the adequate capacity to be able to take care of those individuals. Now, a lot of this is contingent upon testing capacity. Now, you've all been a part of our frequent conversations where we've charted the history behind testing related to COVID-19, but I'm happy to report that we continue to explore new options and opportunities for less invasive techniques, other opportunities to be able to scale up and get more people access to testing opportunities. We've created spaces utilizing our emission center. We've created other alternative sites. Our mobile testing helpline went live yesterday, so individuals who don't have a medical provider can call 240-777-1755 and be linked to a provider to get a triage and screen to determine if they meet the criteria for testing, and they will be provided a referral to one of our alternative test sites or other places within the county that can provide testing. Additionally, we hope to stand up later this week a mobile testing army, if you will, that will be able to go on site and provide additional testing in pop-up venues or specific focus places that have been deemed to be high risk. We continue to work with our ready responders from the state to provide that service already in some limited capacity. Those individuals have gone through and tested a lot of our homeless shelters, as well as families who've been identified by community agencies as high risk, particularly within our high volume zip codes 20902, 20904, and 20906. And hopefully, within the next day or so, we will be able to launch an aggressive high throughput testing opportunity that will initially prioritize our essential employees across the county, including our first line responders, our healthcare workers, and all of the individuals who have been asked to work throughout the last 2 months to ensure that we have adequate provisions and access to services we need for our daily lives. Now, our goal of testing capacity, I know lots of different jurisdictions have talked about this. We want to make sure that before we reopen, we have the capacity and ability to test approximately 5% of our population on a monthly basis. That approximately is about 55,000 tests a month. We feel that we've made great progress in getting to that place. And when we test folks, there's another number that I want to throw out. It's called test positivity. So as we test more folks, ultimately to determine the true effectiveness of our measures, we'd like to see the number of positive cases come down. Currently, the state test positivity is approximately 19%. We're a little bit higher at 24%. So we'd like to see that number come down, meaning that we're identifying and cutting out the number of new cases that are happening within our community. Part of this is also, let me take a step back. Currently to date, we have tested approximately 3% of the population in Montgomery County. And as we said, we want to continue to increase opportunity and access to get that number higher. Part of the other effective toolkit with testing relates to contact tracing. We are working very closely with our colleagues at the state, utilizing the state platform that they have created that will allow for us to effectively contact every new case within a 24-hour period, and then augment and supplement that system with additional resources to do the necessary follow-up within contacts, again, to identify people quickly, get them isolated quickly, and make sure they have adequate provisions to isolate safely, and for other individuals to have access to testing after they've been identified as a contact. Now, the last piece I want to mention is an important area, and this is more so a goal that we look through across all of these different measures and all of the work that we do. We have been told and have seen, even in our jurisdiction, disparities in COVID-related outcomes. We know that we have tremendous work to do to address those concerns, and so equity is an important measure of success in terms of our ability to move forward. So we're making sure that we have initiated those discussions, we're having those discussions, and we've created a framework and infrastructure to be able to address the significant social determinants of health that are related to COVID-19 and make sure that we have apparatus in place to address those inequities that have been documented. So we will be also putting out, I know I talked a lot about the different measures, we're going to simplify this on our website and make sure that folks at home have an opportunity to see the metrics up close, be able to follow them closely, and be able to see where we stand in terms of moving forward. Now, from a general perspective, we are making progress on all of these different measures. As the county executive mentioned, we had seen some decreases in the overall numbers for a few days, and we saw a spike up over the last 24 hours. So we're going to continue to monitor and look at all of the days in relation to one another to make sure that we're making positive progress. And at this time, I'm not saying a particular date of reopening. Again, we will continue to follow and work closely with our colleagues in our peer jurisdictions close by, but we will make sure that folks have access to information to follow along how we're measuring these respective metrics to help determine when it's safe to reopen. Thank you.
County Executive, a virus by its nature cannot recognize a political boundary. And you make the point that in this reopening that will happen at 5 o'clock tomorrow, there will no doubt be more transit throughout the state of Maryland. Given that the governor gave latitude to county like yours to make this decision, they don't seem to have a problem with what you're doing. But given the metrics you just laid out, are you concerned that the governor is moving too quickly on this?
Look, personally, I think he went farther than he probably should have right now. I think he should have waited till the cases were at least on a downturn for some period of time, so that you knew that you had more control over the virus than we have right now. And I think the numbers from yesterday are not insignificant. So I would have wished that he had done otherwise. The fact is that since we're going to stay largely as we were, there won't be opportunities for people to come here and infect. I do worry about things opening up in other jurisdictions and people going there because they can do things. And if you think about some of the rates in the D.C. metropolitan area, I frankly don't think you want residents from here going to places where there aren't restrictions, where you don't have to wear face coverings, where, whatever else, we've asked for. I would wish that everybody is careful wherever they go. And so I think it's more problematic. I worried, when the governor Northam was talking about, what is it, the 14th or 15th of May, of the specter of malls opening in Virginia, and what would happen to, a retail-starved, population that would likely just cross the river or go visit within Virginia, and it had a lot of concern that would reignite, it would become the center of activity. And I was reminded that, I think it was in Chicago, where they traced Chicago's entire outbreak to two parties, two social events. And so you think about a social event, and then you think about opening a mall, that's a problem. I will note, though, that the governor did not open the malls. I read the order again, and what he says is that if you're a mall, and this was true before, a grocery store or a pharmacy that only has access from the inside of a mall can continue to open. But people can't use the concourses of the mall, and the only stores otherwise that can open are stores that have outside access to the store rather than inside access to the store. So even there, he's not fully opened all businesses. There's still this understanding that you really don't want to invite large crowds and lots of opportunities to interact.
Any other questions?
Question for Dr. Gales. You said you'd like to test about 5% of county residents each month. Are you able to give a number for the other metrics, like case positivity rate, where we can say, hey, now we're going to take a look at reevaluating our strategy and potentially reopen? Are you able to give any kind of numerical value to when you would say, let's take another look at this?
Sure. Well, I think in some of the situations, it's most important to see the decrease. But for example, test positivity, we love to see that number below 15%. In addition to hospitalization rate, we'd love to see that number, obviously single digits, but certainly below 15%. Right now, we're at 19, so steady decline. And so what's important is looking at the trends. And so even if we may not achieve that ultimate number, if there's significant movement in that direction, that would give us the opportunity to revisit some of these decisions.
Dr. Galvin,
Question. I read this morning that there's this very trendy restaurant in D.C. said they can no longer remain open without going to reopen. Are you aware, Mr. Elder Committee, businesses that have
I'm not sure I know businesses with name recognition, but I know businesses who said that they don't believe they're going to be able to reopen. I mean, everybody's fear, and this is unaddressed by Congress so far, is that if you're facing 2, now maybe 3 months of back rent, and you haven't been open, the businesses are wondering, why would I bother to open if I'm not going to be able to pay this rent? And if I'm not going to be able to pay it, I might as well close. That is, to me, the nightmare scenario that's facing not just Montgomery County, but America. I am hoping that Congress figures out how to make ultimately the lenders whole. And that's not my normal sentiment. You guys know me well enough to know that. But the truth is that if a tenant, whether they're a resident or commercial tenant, doesn't pay the rent to the landlord, then that landlord's not going to be able to pay his mortgage to the lending company, the bank or the large commercial lenders. And if they're not able to pay and people close them down or evict either the businesses or the residents, we're going to have a very hard time recovering. And so while I think people at that end of the world need to take some sacrifices, they shouldn't be the only people who expect to collect everything that's owed them. I think everybody would like to collect everything that was owed them. I think that we need to figure out a way to spread this pain around enough that we can provide enough relief that businesses don't have to worry about reopening. I've raised this with the governor, I've raised this with our federal delegation, that we really need to take that extra step to make sure people aren't facing a mountain of debt. Because, most small businesses in particular, they don't make a lot of money. They operate on really slim margins. And the idea that in a month or two they'd suddenly be able to come up with 2 or 3 months back rent is just flat out unrealistic. And so I think, and I've said this before, when you fight a war, no one ever says, when are you going to pay this back? We're fighting a war here. Nobody should be saying, when are we going to pay this back and how much is it going to cost? We ought to be saying, what's it take to win this and win it in a way that we get back to normal and as completely normal as possible. And that ought to be a bipartisan message. This shouldn't be the province of any one political party. We all have an equal interest in normalcy returning and people being able to get back to work. But that means they're going to have to do some things they haven't been willing to do so far. Hopefully they can summon the courage to do that.
Dr. Gales, I had another question about testing. You had said that you're at a 3% rate right now of testing in Montgomery County. Is that correct?
We've tested 3% of the population based upon the total number of tests that have been completed.
Okay. Yesterday we spoke to Dr. Nesbitt in D.C. about testing, and she explained that in the district, they have criteria on who they test. High-risk healthcare workers, somebody that's been exposed to a COVID-19 individual. Is that how it works in Montgomery County? And Dr. Fauci said in his testimony the other day that the road to recovery runs through testing. So why 2 months into this are we only at 3%? Could you explain the hurdles, the challenges? Why do we not have a robust testing effort underway in what is the whole of the National Institutes of Health?
Sure. How much time do you have? To be perfectly candid, the lack of testing capacity is not only something we've experienced here, it's experienced across the country. It's been one of the great failures of the system, and in large part due to the lack of leadership from the federal government in providing us the resources that we need to accomplish that goal. If you remember back to when we had our first 3 cases, March 5th, at that point, the criteria that were provided, we were only testing individuals who had a travel history that was significant for Wuhan. Then it was expanded to China, and then it was expanded to, I think there were 4 other countries for the following weeks. And in fact, our early cases had traveled to a location that was not a part of that list. And so not only was the criteria limited for a long time, the supplies were limited. I know we've talked about this as an example before, but when the testing first happened, it was only testing at the CDC. you had to call the state, you had to call the local health department, call the state, and then call the CDC to get a consultation to determine if that individual should get tested. And so that process matured to states were allowed to test. We received a manila envelope of 31 test kits to be able to distribute, to follow up on. And so as even when private laboratories came online, there were still significant issues with nasal swabs, reagents, and things like that that limited the capacity to be able to move forward. So part of the big challenge with being able to mount a robust response, to be able to test this significant number of people, has been the lack of lab capacity and the lack of equipment. And so to that end, my colleague in DC, Dr. Nesbitt's point, yes, there have been criteria provided by the CDC and the states to determine who should be tested. Up until about a week and a half ago, that criteria still heavily relied on individuals having symptoms. The CDC changed that guidance to talk about making provisions for individuals who are asymptomatic because, as you know, as through this process has moved forward, we found out and discovered that asymptomatic individuals can transmit the virus. And so moving forward, all of our jurisdictions are looking at strategies to increase access to testing in general, but certainly capturing that particular population so that we can have an understanding of who they are and, again, get them isolated quickly and interrupt their networks of transmission.
Quickly follow up on this. On May 16th, you ballot is that still the same case? Are you still having those challenges in getting tests, getting swabs, and getting the kinds of things you need to move forward the way you want?
Well, thankfully, we have a very active team in the county who has been helpful in terms of identifying new testing opportunities, new testing modalities. Science has moved along as well. So if you think about it, in the very beginning, tests were only done a certain way. Now we've moved to the point where we can do self-collection in many ways, which is what we're going to promote, hopefully releasing those details soon. We've also seen the number of labs to be able to provide those services increase. So it is a function of time. It's a function of science. But the hope is moving forward that we won't be hamstrung by those limitations that has limited our response over the last 2 months.
Can I add to that? Yeah. I just want to relate a couple of things I think are relevant. You know, the governor announced that he had 500,000 test kits, but he didn't have the reagents and the swabs. That's not his fault. And they haven't been able until recently even to get that. I mean, the swab story is crazy. There was one company in Italy that produced virtually all the swabs in the world. And there had to be an order by the president to actually force people to make this stuff. But reagents have been a big issue. Johns Hopkins last week announced, I think it was a new test. And in the same paragraph, and they said, and our problem is getting reagents. We're not able to get enough reagents. Our congressional delegation wrote a letter saying we want the federal facilities at NIH and Walter Reed to lend us their testing capacity. And I think NIH's response was, we're happy to let you have access to our machines. We don't have reagents. So the policies that were originally put in place were best practices based on limited supply. It was sort of like, if you've got a limited supply of these things, who do you ration them to? Who are the people that are most at risk? They weren't what you would call pure best practices, which would have been contact tracing and testing everybody in that contact chain. Would have been being able to open up more stations sooner so we could test populations. It would have been a much more aggressive approach. But the policies that were put in place by both the federal government and the state government acknowledged the limitation of resources and tried to direct testing toward those limitations. In Montgomery County, our scenario is changing, as Dr. Gale said. We have one contract. We're anticipating a second one. We will be able to do a significantly different job once this stuff is all in place, and that should happen very quickly. I went looking for tests probably, weeks ago. And I once actually found 500,000 tests and then couldn't find a place to process them. If I bought them, they would just be useless because nobody could do the throughput the way they needed to be done. So I've personally experienced the frustration of finding stuff and then discovering I can't use it. So things are changing, but everything that's happened up to now has been definitely a result of an ill-prepared response to this by the federal government and nobody getting their act together and making sure that the supplies were in place. But we are and have been working very hard to change that.
Just want to make 2 points for you all. We'll be putting out a news release later today, which will spell out what you just heard. But the key takeaway is that the restrictions in Montgomery County are not being lifted. We'll spell it out. We'll share it with you later today. We are sharing a lot more information on social media, so we encourage you to follow the county executive's Twitter feed, which is at Mark, M-A-R-C, _ELRICH. Montgomery County, Maryland's Twitter feed at Montgomery COMD, and of course on Facebook. And we appreciate you all being out here today.